Summit Psychological Associates offers a wide variety of clinical and forensic psychology opportunities. All interns will work with clients in an outpatient setting, but you'd also be able to choose from a variety of other opportunities. Outpatient services at Summit Psych include general mental health individual counseling and substance or offense-related individual or group therapy. Groups currently being ran are for sex offenders, domestic violence perpetrators, and those with substance or parenting concerns. Some members of the 2020-2021 internship class and other staff will be sharing information about all of these experiences, which includes work in community correctional, court, and jail settings.
Hi everyone, my name is Dr. Obradovich, also known as Dr. O. I'm the primary clinical supervisor for the forensic internship at Summit Psychological Associates. I'm here today to talk to you a little bit about our sex offender treatment program. First thing to know is that our program is certified by the Ohio Department of Rehab and Corrections, which is also known as ODRC. Our sex offender treatment program is quite comprehensive. It's a goal-based program, and there's 3 separate levels that a client must progress through before they can successfully graduate the program. So everyone starts at level 1, and level 1 is focused on demonstrating accountability for all offending behavior, as well as developing an understanding of the offense cycle. The offense cycle we use is a 10-step cycle, and it includes various things like predisposing factors, deviant fantasies, overcoming obstacles, planning and grooming, thinking errors used, triggers in high-risk situations, false promises, shame and guilt. And once the client's able to develop that offense cycle, they present it to the group. And once they're promoted to level 2, the shift slightly changes, and at that point, the client is going to work on an autobiography that helps them gain further insight into how those predisposing risk factors developed over time. And level 2 is really focused on resolving and reducing underlying factors to the extent possible. So that might include things like learning healthy relationship skills and boundaries, coping skills, how to correct thinking errors, effectively managing triggers in high-risk situations. And once the client completes the goals of level 2, they are then promoted to the final level, which is level 3. Level 3 is focused on developing a relapse prevention plan, as well as victim empathy and apology letters. And once those things are developed and presented, the client also has to show that they're able to use that relapse prevention plan. And assuming that happened, they successfully graduate our program. Now, there's a few additional things to know. One of those is that we do have federal sex offender treatment groups, and those clients are also required to successfully pass polygraph exams as part of treatment. Another thing to know is that we often try to recruit a significant other in the client's life to serve as an accountability buddy, and we like them to participate in treatment at some point. Most times it's being involved in the relapse prevention plan. Some of our clients need additional services, so they might also be getting psychiatry, substance abuse, or mental health treatment while they're in the sex offender program. It really just depends what they need. So in a nutshell, that's our sex offender treatment program. I could go on and on. Because we're certified, interns get 12 hours of sex offender specific training that I provide, and that gives me an opportunity to go on and on. So hope you enjoyed that. I look forward to answering any questions during interviews. Thanks so much. Bye-bye.
Hello, my name is Laura Fogarty, and I'm an intern at the Summit Psychological Associates, or SPA. I'm here to tell you about another opportunity that's offered through the Ohio Psychology Internship at SPA. It is the chance to work with Oriana House, a network of community-based correctional facilities that offer different levels of programming for forensic clients. Some of these sites are community-based correctional facilities, or CBCF for short, that are alternatives to state prison for felony offenders. Other times, clients are placed at the halfway house as a sanction for violation while they're on probation or parole. As clients receive structured education, treatment, and reentry services through CBCF, interns at SPA have the chance to call in or to potentially visit in person post-pandemic every week to speak with any residents that wish to process anything on their mind, which might include things like adjustment stress to their new environment, symptoms of depression and anxiety that are often found with residents in these new settings, crisis management, and help in setting goals, both while in CBCF and after they are eventually released to the community. Prior to the pandemic, the intern would go visit in person to the facility and provide a combination of groups and crisis or brief individual sessions to the residents, and we are hoping to return to this opportunity before the year is over. Calling in to speak with these residents has been a really rewarding experience so far, as it provides an opportunity for solution-focused counseling in addition to crisis management. Each week provides a different experience and really keeps interns on their toes in terms of switching clinical gears between clients to respond to each resident's needs during the 4-hour block of call-in time. The most rewarding experience so far has been noticing clients progressing through the program and celebrating victories with them as they share with you successes such as passing their GED classes, being approved for community passes, having video called with loved ones, or learning new skills and insights through their classes.
My name is Dana, and I'm one of the current interns here at Summit Psychological, and on Wednesdays I get to work at Barberton Municipal Court, which is an outside agency that interns have the opportunity to work with that provides diagnostic and treatment assessments, as well as individual and group therapy. Pre-COVID, the typical Barberton schedule consisted of 2 assessments, 1 group or individual, and an additional individual session with lunch in between. However, everything is currently conducted through telehealth with 2 assessments every other Wednesday. These assessments consist of a typical psychosocial intake interview and lasts up to an hour and 15 minutes. The intern then writes 1 to 3 page report that is sent to the court with the client's social history, alcohol and drug history, mental health and treatment history, any other pertinent information, relevant diagnoses, and treatment recommendations. Assessment clients are referred through the court and have typically either been charged, convicted, or are awaiting sentencing. Although my experience has been strictly through telehealth due to COVID-19, everyone at BMC is extremely kind and willing to help whenever they can. They operate on an open communication basis and are always available to answer my questions or help with connecting virtually to clients. Overall, Barberton has been a wonderful experience and a great way to increase my interviewing and report writing skills. It is important to note that due to the nature of the site and the need for written reports and letters, there is some writing required outside of work hours.
Hi, I'm Dr. Wooster. I'm a postdoc at Summit Psychological. I'm here to talk to you about the various evaluation opportunities at Summit Psych. Firstly, all clients entering treatment complete a diagnostic assessment. This is a great opportunity for interns to hone in on psychosocial interviewing skills and provide appropriate diagnoses. Evaluations include, but are not limited to, forensic evaluations like competency to stand trial, not guilty by reason of insanity, pre-employment, fit for duty, pre-sentencing evaluations, both juvenile and adult sex offender risk evaluations, general mental health evaluations, parenting evaluations, guardianship evaluations, and civil commitment evaluations. Additionally, there are opportunities for medical evaluations, such as determining appropriateness for spinal cord stimulators and bariatric or gender reassignment surgery. All evaluations will be completed with a licensed psychologist or a psychology assistant.
Hi, my name is Jamie Gillio, and I'm here to tell you about another opportunity offered through the Ohio Psychology Internship at SPA, which is the chance to work at the Summit County Jail several days a week. In this track, interns have the ability to develop skills in crisis management, intake, and solution-focused counseling. Responsibilities include performing diagnostic assessment, providing brief, solution-focused therapy on an as-needed basis, performing suicide risk assessments, assisting in decisions of risk, level of care, housing and safety precautions, as well as discharge planning. The population at the jail is diverse. It includes male and female inmates from minimum, medium, and maximum security levels. Each inmate shares unique experiences and presenting concerns as they meet with the Behavioral Health Department to begin treatment. One of the greatest strengths of working at the jail is the opportunity to work with a multidisciplinary team, including social workers, therapists, psychiatrists, physicians, and nurses, to provide inmates with the most holistic care available in the correctional setting. There are ample opportunities to shadow others and learn while in training, as well as ongoing support for case consultation with coworkers as the intern transitions to meeting with clients independently and working autonomously throughout the jail. Each day at the jail is a unique adventure, and the clinical and personal growth that come from working in this setting is unrivaled by other sites.
Hi, my name is Dr. Michelle Murdoch. I completed my internship and postdoctoral fellowship at Summit Psychological Associates. During my internship year, I facilitated the Dual Diagnosis Offender Program, or DDOP. DDOP is a state-funded community corrections program designed for clients on probation, specifically in Portage County, Ohio, who have a co-occurring substance use and mental health diagnosis. The intern who works with DDOP will go to the Portage County Adult Probation Office in Ravenna, which is approximately 35 minutes outside of Akron. There, they work directly with probation officers and assess individuals for eligibility and appropriateness for DDOP. The assessment includes administering the Personality Assessment Inventory, or the PAI, and the Substance Abuse Subtle Screening Inventory, SASI, and conducting a diagnostic assessment. The clinician will then make treatment recommendations with dosing hours based on risk level, and if appropriate, the client is then referred to a once-weekly group, which is manualized with the CBT Foundation. The group is held at the Portage County Probation Department and facilitated by the DDOP intern. If you have any questions about DDOP, we are more than happy to answer those during internship interviews. Thank you.
Hi, I'm Dr. Tara Toscano, former intern and current postdoc here at Summit Psychological Associates. Summit Psych has a wide variety of referral sources, including many court and probation or parole offices within the counties surrounding our offices. In regards to domestic violence, we work very closely with 2 court programs through the use of a court liaison, but also get referrals for treatment and evaluations from many other courts and PO offices. Domestic violence groups for perpetrators include 10-week and 26-week conflict solutions groups and a 52-week batterer intervention program. Interns have the opportunity to run the 10 and 26-week conflict solutions groups independently. In addition, one intern works as a court liaison with Family Intervention Court, which is a domestic violence diversion program. Duties include going to an interdisciplinary meeting once a week and court for Family Intervention Court participants once a week as well. In this role, the intern gets to provide the mental health perspective to the court. It is a fulfilling role to educate and advocate in this manner. In addition, the intern assists throughout the week with communication between the court and Summit Psych employees about court participants' progress within their programming. This is a wonderful opportunity to network and become familiar and comfortable with the courts, along with working on an interdisciplinary team.